Hi, everyone, and welcome to Mental Health for Working Parents, where together with mental health professionals, we speak about the various emotional demands of parenting without shame or stigma. And today, my guest is Dr. Emmy Meyers. Hi, Emmy.
Hi, thank you for having
And
me.
thank you for coming. And Emmy is a professor and is a practitioner, a clinician with more than 30 years of experience. And Emmy's specialty is siblings abuse, which is such an interesting topic. And I think initially when I've contacted you, I've said, Emmy, please come to my podcast because I have two kids and I'm the only child. And I would really like to have a chat with you to speak about so many things that as a parent who has siblings, I have two boys, are, just very concerning to me. And I think they're so kind of common, so I've basically, this is how I've approached you. And then we had a conversation about some of the things that we're also going to cover today. But I do want to ask you in the beginning, can you just tell us a bit about why did you decide to specialize in this area? Because I think this is not something that's spoken about a lot. And yeah, can you just talk a little bit about how did you come to that specialization and why siblings abuse?
Sure. So when I embarked on my PhD, getting my doctorate, we knew that we were going to be immersed in research for a few years. And our professors warned us at the time that you better choose a topic that you can stay with for the long haul, that's really interesting to you and curious to you. And then another professor called his research and research in general me-search, which I thought was very interesting, which means that most people tend to be really interested in things that touch them in some personal way. And so growing up during my teen years, I was a target of sibling abuse from an older brother. And of course, I wanted to understand the dynamics around that, what creates that, what perpetuates that, what are the enduring effects. And I thought that it would be really interesting to do a qualitative study where I got to use my clinical skills, because it requires interviewing participants, and really get into the lived experience of what that was like for other people. And I'm not sure, I mean, this was a while back now, and I'm not sure whether I was conscious of this or not, but it was a healing experience, because my experience was being validated as I was hearing the stories of other people, because in our society, it's not, it certainly wasn't, and it's still not now, really talked about. It's kind of this very private phenomenon that stays within the family, I think, because one, there's a lot of shame around it, but two, there's a lack of societal validation of the experience. So you feel very alone in it. And the term abuse wasn't really even present as a concept or an act between siblings. It was, when I started to look at the literature, it was referenced, and the term was used interchangeably with sibling aggression, sibling violence, sibling rivalry, and they're all very distinctive experiences. And then I also noticed that, if you do a search, because we had to do a literature review of what's out there, you do a search on parent-child abuse, there's, at least 4,000 articles related to the topic of some sort. And you do one of sibling abuse at the time, this was around 2005, there were probably about a handful.
Yeah. And I think that has also been my experience. I obviously wasn't kind of doing, any kind of research extensively in the area you're talking about. But as I was kind of trying to find some of the books on helping me as a parent to, just kind of know how to manage some of the, I guess, common aggression, what you were calling in between my two sons, I was noticing that there is not much available. So in many ways, I think this is just kind of part of what you're talking about. And also, I find it really interesting that I think as a society, we kind of speak a lot about bullying, and the fact it would have on the development, there are kind of a lot of ideas around how to I don't know, manage or cope with bullying at school. But when it comes to what happens inside the family, and I think you're right, obviously when it comes to kind of a relationship between a parent and a child, perhaps there's more like awareness around it. But definitely when it comes to what's happening internally with the relationships between siblings, we don't really talk about it. And it's really interesting because obviously this is such a primary relationship. And I would think that's a huge part of an attachment model that we have.
Absolutely. I mean, our siblings are our most important peers. We spend more time with them than anybody else. They're our longest relationship if we don't cut them off, right? They're our longest relationship that we'll ever have. And they have a significant impact on development. And there is not anything that I'm aware of that is in the literature, the psychodynamic or the psychoanalytic literature that discusses the attachment styles that can develop from the sibling relationship. Because siblings shape our sense of friendship, our sense of loyalty, our sense of self, our understanding of intimacy, our ability to trust. I mean, there's so many aspects of that relationship that are so important.
Yeah. And, thank you for kind of sharing, your own story. And I know you've mentioned, that kind of experience with your older brother. And I'm wondering, would it be quite common that in most cases of abuse, I don't know if it would be accurate to say that it's older children normally who are I guess, abusers mostly?
Yeah, I think generally speaking, I mean, I certainly found that in my study. My study was rather small. I think I had 19 participants. So to generalize globally, would be a little bit of a stretch. But yes, I found that. And I think from what I've read, that's much more common because there's already a power differential built in, right, for an older sibling. But I've also interviewed an adult child who was abused by a twin and another one who was abused by a younger sibling. So it does happen.
Yeah. And could you just talk a little bit about what causes that?
So yes, what causes that? So I like to kind of conceptualize it as a systemic family issue. And I know you come from this angle of not blaming, and I think that is so important. It's not about blaming parents, because I don't think that any family system consciously, incites this kind of a relationship. But there are a few factors that contributed to it. One is the intergenerational cycle of violence. So those parents who had destructive or very conflictual relationships with their own sibling tend to kind of pass that down. And it's a learned relationship. When I say learned, it's not that it's taught. It's just that, we
non-verbally.
We tend to repeat what we know, right? And if we don't have a model for a healthy sibling relationship, it's hard to cultivate that in our own children. Another aspect is favoritism. I often say that every child within the same family has a different parent, meaning that the way that we relate to each child is very different depending on multiple factors. Sometimes we feel more of an identification with a certain child, right, based on similarities or characteristics that just make us feel more aligned with that child. It could be who the child reminds us of, right? Maybe they look like us, and there's a greater affinity to that, especially if there's a difficult relationship with the partner or spouse or a divorce. And that child reminds you of that person, then, we can tend to relate to that child differently. So favoritism can, come about from multiple factors. And it doesn't mean also that one doesn't relate differently to each child through different phases of development. So one child could be your favorite at one point, and then you could switch alliances. Collusion is another factor. So when you tend to use one child, again, not always consciously, so I'm not blaming. It's very important that we don't blame, but I just want to set the structure first. If you need that child to kind of protect you in some way, to support you in some way, to validate you in some way, then there can be a collusion, which can look like favoritism, but it's often a step beyond that because the child is being used against another family member, when there might be misdirected anger at another member of the family, and that child is used as a support. Another factor has been the child being in a caregiver role. And so that kind of breeds resentment towards the younger child. I say younger, but it could be the other sibling who's not equipped to be in that role. And so even though there could be, say, a 4-year age difference, it doesn't mean that that child should have parenting responsibilities. And so they kind of distort their sense of power. And sometimes they might attempt to parent the younger child in a way that they don't have the tools to do. So their form of discipline, right, could be overly aggressive. But there could be problems with that child who is the aggressor. I want to make this very clear that can be characterological. They could be mentally ill. They could be abusing substances. They could have something going on at school where they're being bullied or targeted. And so it's a displacement to the child who's less powerful in the home. So there's so many potential dynamics that can create this.
Yeah. And, I just kind of listening to you, I was thinking how, to some extent, all of the things that you've named can be so common, because I know I recognize some of them, even, to some extent, in the way that I parent. I really remember when my second son was born, and the difference is like 2.5 years between my children. So my older son was obviously very young when my younger son was born. But then we got back from the hospital, and I remember I was kind of carrying a baby, and I walked in and I saw my older son, and he looked so big, obviously in comparison with the baby. And there was like this part of me that kind of wanted to somehow, place those expectations on him that he's going to be like a big brother, where in reality, obviously he was like a very small child. And I think we were talking a lot about making sure that he gets most of the attention when we're kind of going through that transition, because it would be more challenging for him. And theoretically, I was very much aware of that, but practically it was really difficult to do, because I think biologically that need to protect a baby all the time, because the babies are small and fragile, and obviously a toddler can just accidentally kill a baby, literally. So I think biologically resisting kind of that need, which is in many ways to protect, while also kind of not rejecting and not making like my older son to be this like an aggressor that you were talking about, was incredibly challenging. So I just kind of really want to recognize that some of those things I was doing, so I think all of us to some extent would do it certain part of the relationship, but I guess it's really kind of noticing them and being mindful of them, and also helping ourselves, right, to find the skills how to navigate it. And I think it's just something that has been one of the challenges for me.
I mean, I think an important part of what you just said is that you were coming from a good place.
Yeah.
Right. So, and that's really important. But maybe at that point, you didn't have the tools or the knowledge to understand what that potentially could create. Right now you do, maybe in retrospect, or maybe you did then, and that allowed you to kind of really manage that. But you're really talking about expectations, right? That we are projecting onto the children. But coming from a good place, you're wanting to protect, but what does that create for such a young child in terms of his conceptualization and understanding, and how that's being taken in and internalized of what mommy wants?
Yeah. And I think something that you were talking about, this idea of like being a parentified child, when kind of an older sibling does take that role of being the one who helps parents, especially I guess if the age kind of difference is bigger, because it's quite difficult with my children to do that, because they're so kind of small, they're so like close to each other in age. But I think with older siblings, something that I see a lot, like with the clients who I work with, that's being parentified, really holding a lot of responsibility for taking care of these children who they haven't really asked for, and it's kind of, they're really given something that's so heavy, without actually being adults, right? Without being grown-ups, without actually choosing to do that. So I think, this is just like, I guess, like looking at it from this perspective, it seems that resistance that can then create an aggression and then can kind of transform into an abuse potentially is quite logical, I guess.
Yeah, but I don't think at
Development.
that age, at the same time, that you're really cultivating a destructive
Yeah.
relationship. I think it's a little too early. And as you were speaking, it just made me think about, isn't it so interesting how, some kids welcome that child. You come home from the hospital and
Yeah.
they can't wait to feed the baby and touch the baby, and they just fall into this loving role. And then there's the kids who are jealous and resentful and, send that baby back to where it came from.
Yeah.
And nothing creates that. I mean, maybe at some point there's some preparation, obviously, that you can do to help the child get used to it and, what it's going to be like to have a little brother or sister, but it's pretty characterological.
Yeah. Yeah. So what you're saying, there is nothing that we can do as parents to predict some of that, how different children are going to respond to having a sibling, how is that relationship going to shape. So in a way, we can obviously be mindful and kind of try to avoid some of the things that you were naming as a cause of abuse, trying to, the points that you were naming, but it still doesn't mean that it's not going to happen. And I think this is part of not blaming ourselves for everything as parents.
Yes, I think part of it's innate.
Yeah.
And as you said, it's how do you manage that or handle that once you see certain signs that there is animosity or resentment developing.
Yeah. Yeah. And
but interestingly, I just wanted to say that for sibling abuse, the average age of onset, it seems from my study, is 6 years old. So you're talking about, right, much younger than that. There's not a lot of leeway, much younger. It's 6 years we're talking about. But so that's significant. It's when, there's a new developmental phase happening.
Yeah. And it definitely kind of, I'm thinking of, a couple of clients I'm working with, and I think it really corresponds with what I know about some of their histories as well. So, when you were talking about the science, and I want to kind of talk a little bit more about it. So, I just think you were talking about how there's going to be part of that relationship between the siblings is going to really be, about arguing, fighting, confrontational side of the relationship. And I see that, in my children, when it comes to, I don't know, having toys, wanting attention, kind of arguing with each other, fighting with each other physically. So what would be kind of the signs, what would be the things that are normal, and what would be the things where as a parent you could think, okay, so maybe something more is happening, maybe I need more support, maybe there is, one of the siblings needs more attention, or we just need some kind of interventions.
Okay, so that's a great question. And to me, there's two parts to that. So one is, let me just distinguish between normative sibling rivalry and sibling abuse. So sibling rivalry is a normative part of development. It's healthy. Yeah. It builds skills of cooperation, negotiation, competition, conflict resolution. And what it means is that your children are going to argue and they're going to fight. And what that looks like, though, is that each one has an equal opportunity for advantage or disadvantage, meaning within one argument, maybe your one child is going to be the aggressor, and the next argument, your other child is going to be the aggressor. Or in the same argument, one is the aggressor, and then the next few minutes, the other one is the aggressor. So it's a back and forth, right?
Yeah.
Okay. Sibling abuse, first of all, there's no positive outcomes from it, right? So unhealthy. It also means that there's one child has all of the advantage, all of the power. So the other child can't argue back, can't fight back, or attempts to, and the repercussions are like tenfold, right? So if a child tries to stick up for themselves, they're going to get it even more, whether it's verbal assault or physical assault. So I just want to also say, as a caveat, I'm not talking about sexual abuse. I'm talking about physical and or emotional abuse. So with sibling abuse, one child holds the power. And why it's often an older sibling is because that power comes from role differentiation, right? That comes with being an older child. It comes with greater size, greater weight, and usually greater responsibility.
So what you're saying is kind of when the roles are fixed and then those relational patterns are fixed, where one child is more an aggressor or kind of a prosecutor and another child is more like a victim psychologically, and there's and when it's fixed and then those patterns are just really consistent, I guess, kind of in time as well, then there's something where it's more likely that it's a bigger problem than just something that normally would happen in the relationship between siblings, and that can just happen throughout a day on a number of times, and it's just really a normal part of the development and growth.
Yes, and I would say, like, use your gauge, right? Hopefully you have a healthy gauge, because I will say this, let me just sidebar for a second. There is also a lot of presence of parent-child abuse in the case of sibling abuse. So one, it's learned behavior as another aspect when you say what creates this earlier. And two, it's displacement, right? So if I'm being abused by my parent, I obviously can't attack them back, but who am I going to take that out on? So generally speaking, the parent who is able to gauge what their child is experiencing should be able to intervene. Now, your question about how do I know, right, as an informed, intelligent person who works in a mental health field, right, and so already has your radar up, I would say, when it's sibling rivalry, when you see that it's mutual, it's healthy to let them work that out. As long as nobody's really, really getting hurt. If you see that one child is more often the target and that they can't protect themselves, then you should intervene.
Yeah. And I think, just something that commonly I see, I guess, for many parents is that, it's very kind of difficult because a lot of, as you've said, we're all kind of learn from our own parental modeling, if we didn't have siblings, or we had a certain relationship with a sibling, that this is what we're going to unconsciously, whether we want it or not, is just we're going to bring it. I always kind of say 90% of how we perceive reality is based on the past templates. So, and they're all unconscious. So we're kind of still, no matter how aware we are, we're going to bring that in. But I think, it's really something that is a challenge that I see in myself, but also in the parents I work with, is that fixing part, when there's something that's happening in between my sons, my kind of, it's really resisting my need to join in. And obviously, I'm not kind of talking about when they're killing each other, literally, I'm just talking about those daily instances that are so many of them, where they're just like trying to solve a problem in between them, where they're just really like learning those skills that you're talking about. And then I think as parents, if we do come in, then this can actually create a bigger issue in a way for the relationship in between them, but also in my relationship with them, because then it's almost kind of me becoming a rescuer and coming in and saying, okay, you're wrong and you're right and you're my favorite and you're not, because I think it's also quite important to keep in mind the child's interpretation, right, of those situations. And I know at the same time how difficult it is sometimes to resist that, because, as I said, we're all going to bring our modeling, and we're all kind of going to have different triggers. And I think this is really something that is a big challenge for just parenting several children, right?
Absolutely.
To have that perspective.
So I think, in those moments maybe that you want to intervene, you think about what it is that you would say during that moment. And is there an opportunity when it's not happening to intervene with one of your children, to provide a skill that wasn't there that you're seeing? Does that make sense?
Yeah.
So I'm thinking about like cultivating empathy, right?
Yeah.
How do you cultivate empathy within your children, trying them to understand what the experience must be like for the other person? Now, I don't think that is going to convey favoritism, but you can also do that outside of the sibling relationship, just in general in society, with observations that you may see happening when you're at the supermarket, and you see a screaming child, right, just having a tantrum. What do you think that they're experiencing, right? Or incident in school that they're coming home and telling you about. So there's ways to cultivate that without, specifying the sibling relationship, though there's nothing wrong in specifying the sibling relationship.
Yeah.
And so that could be even a point of intervention as it is happening. What do you think child A is going on with child B right now? Child B, what do you think is going on with child A right now?
Yeah. And I think, that's kind of was leading to my next question that I was going to ask you, that if there an abuse does actually happen, or, even outside of the like abuse, those kind of normalized conflict, that every relationship is going to have. So there's going to be this ruptures every day. And I, just kind of as a parent holding that empathy sometimes also for a child who is in the wrong, who could be perceived as an aggressor, is such a challenging and important tool, like a skill to have. And I just kind of do want to ask you, can you talk a little bit about this idea of punishment and abuse? Because I imagine, and I don't really know, that it's just kind of more a fantasy of mine, that parents, when they do kind of find out, or they notice that there's a situation, there could be, I guess, one coping strategy is to kind of ignore it in a way by the part of this shame, when we don't talk about things that happen inside the family, and kind of hope that they're going to be resolved. But then another strategy would be that punishment, we're going to punish. And I'm talking about kind of, again, as I've said, it's not my experience, but this is what I like imagine would happen based on my just working like a client worked, and then we would punish perhaps a child who is an aggressor. So can you just talk about your experience of punishment, dismissing, maybe pretending as a parent that it's not happening, not again as a way to blame, but just kind of wanting perhaps, or not knowing how to deal with that?
Yeah, that's a terrific point of discussion. So in my study, I found that where were the parents, right? That was a question. Where were the parents when this was happening? And a lot of them did not know how to manage the relationship, right?
Yeah.
So, and also some of them were actually being abused by the abusive child. And a lot of them also weren't present, either physically or emotionally. So they had their own stressors going on, or their own challenges in life going on, and they weren't either physically present to see it happening. And so it was all said and done by the time that they maybe got home from wherever, work, or they were there and they really just, were kind of a passive observer of what was happening. So I think the first point is really important, which is what do? We have to take an active stance, right? And to be mindful that sibling relationships are really important, and we have to observe and intervene when we see things happening that we know might not be healthy. So I think it's really important, first of all, that if there is a target and there is an aggressor, that both of them receive intervention. Now, I'm going to come back to in the home intervention, but let me just say regarding outside intervention and maybe seeking mental health services. So historically, the target, right, the victim is often taken for treatment, which is really important because yes, you know, they're going to have a lot to work out, right? Either as it's occurring as a child or as an adult after having endured this.
And by treatment, you mean therapy? What do you mean by
therapy?
treatment? Yeah.
I do mean therapy. Yes.
Yeah.
So, but doing that is helpful, one, because obviously they're getting help and hopefully their experience is being validated, but only if the therapist understands sibling abuse, right? That this is real and there are consequences and repercussions and all of those things. However, it can also have a negative effect in the sense that the target experiences that they are the cause of the problem, right? So both children really do need assistance, because I don't want it to be perceived that the aggressor is just this bad seed, right?
Yeah.
Or this terrible person. It's that they obviously have something going on that is creating this kind of behavior. And so they also need help. Where do we start? Let's start in the home. And so you're raising an important question about punishment. And I assume that the question is, do you punish? Should you punish? How do you punish? Right? Well, generally speaking, what has happened is that the victim, the target, is so upset and distressed and creates such havoc in the home because they're crying out for help, while the aggressor has now gotten out his or her, you know, pent up rage, not pent up, gotten out their rage, and they are now kind of satisfied and quiet. So you can see how the target becomes the problem or the identified problem. And so it's important to recognize that if there is this kind of disturbance in the sibling relationship, both children need to be tended to. Now, go ahead.
I was just going to say, you know, I think it's so important because I kind of work with trauma, you know, and I think it's really important to recognize that that behavior from the both sides, right, would be a trauma response to something that's kind of happening, that would be underlying causes. And, you know, I'm just really kind of thinking, I guess, of that language, a target, an aggressor. I just want to ask you, do you think it's kind of helpful to use that language like for the families, because it's almost kind of creates that sense of, you know, there's this aggressor who, it's almost kind of they're not someone who would need the empathy, they would not someone who would need help, they just need to be like isolated, and perhaps it's almost like a label in a way, or perhaps
pathologizing. Labeling, absolutely. And it's funny that you're raising this because I've just switched to that terminology, and that's something that those of us who work in this niche are struggling with, because some people use abuser and victim, and you know, the victims don't like that terminology because I don't know, it creates some kind of shame. It creates a sense of helplessness, but it also captures the reality. They are a victim. Target feels a little softer, perhaps. Aggressor instead of abuser. So it's interesting. Language is so important, as we know. And it's food for thought. I'm not conclusive on it, but I'm not saying also necessarily that is language that I would use with a family. But it's just, you know, as a researcher, as a clinician, in terms of conceptualizing the distinction. And
I think I'm just like saying this just like really to give kind of context, you know, for the parents who are going to listen, who are not kind of mental health professionals, you know, and who kind of don't have, I guess, that knowledge around trauma and the way it can kind of impact the relationships we have. But, you know, I think it's just something that, you know, when a child is being abusive or aggressive, that also would be signs that basically they need help with coping or processing or, dealing with some kind of experiences, or, events, or something that has been perhaps traumatic, or they've experienced that as being traumatic. And I think it's just really something important for parents to know, who would just kind of think, my child is an aggressor, and then my other child is a victim, and then all I need to do is just to, and of course, as you've said, it is the reality in many ways where there would need to be this protection. But I think it's really, I'm just like thinking, I guess, how to deliver the message that both of siblings are going to need that attention and care and nurture, and I don't know, just like really a lot of empathy, so it doesn't actually become something that's going to be fixed for
well
life.
said. I mean, hopefully that just did that for your audience, right?
Yeah.
The idea that we're struggling with terminology, exactly how you just clarified it, it doesn't mean that. But, there's a lot of big words that we use, or, big meaning, very intense and meaningful, like trauma, like you just used.
Yeah,
right?
absolutely.
A lot of people don't want to kind of associate themselves with that. Some people do, would find it validating. So, it's hard. Yeah.
Yeah.
But I do want to answer your question about
yes, please. The sorry, I was just picked up on the word because it's
important.
Sorry.
Important. No, very important. I didn't want to leave you hanging. So just in terms of like a punitive approach, of course the answer isn't being punitive. We know that, I think, as a society, that punishment doesn't really help. But so what's the other side of that is identifying somebody's strengths, identifying what they do have to offer, how they can build on that, how you can help them build on their sensitivities, because, these aren't people, the aggressors, I'm just going to use that for clarification sake, aren't people who are void of having a conscience, right? They're not sociopaths, or most of them. There might be one or two out there, right? But they're generally troubled people, troubled children, troubled teens. And so again, I think it's just coming back to that empathy, and which is really hard as a parent, because when you see your one child being targeted and hurt, what do? You want to go into protection mode. And part of protection mode is getting angry at the one who is imparting the pain, right? So it's very hard. It's incumbent on us as parents to kind of pull back, right? And in the right moment, in the moment of the actual occurrence, you do have to remove that child, send them to the room, ask them to leave the home, come back when they're feeling cooled down, letting them know that behavior is unacceptable. But it's just like a child who is not committing sibling abuse, but is doing some other behavior that's unwelcome or unwarranted, is you let them know that the behavior is not acceptable, not them, right, as a person, and distinguishing the behavior from who they are as a person. It's not the all of them. It's not the sum of their parts. But that piece about cultivating empathy, is a really important piece. How do you do that, right? And so that's a whole nother discussion about how do you let your children know or develop that ability. And it's an important skill in society as well, right? Because we all carry multiple identities, and we all judge, and we all have biases. And how do you work on that? Yeah.
And I really, kind of think that idea of empathy towards ourselves, and and I think it's so important what you've said, because in a way we kind of all learn to accept ourselves when we're doing something that we perceive to be good or great, when we achieve something that we want, so it's kind of we're giving ourselves empathy, then we think we deserve it, but we actually need empathy when we're at our lowest, right? And I think this is just, as parents, what we need to give our children, that we give empathy when all the time, not only in those moments when we think that they're doing something that they should be doing, but I really think that self-talk that we had modeled to ourselves, where it's almost like empathy, I only deserve empathy, when I'm kind of okay. But there are so many moments where I still, I'm kind of learning to just really be mindful of giving myself empathy just because I am, just for being with all those different parts that you were talking about. And I think it really starts with kind of learning that for ourselves, because then everything that children will go through lives, is not going to be fixed.
Yeah. I mean, you're really also talking about self-esteem. And
Yeah.
I think that that's something missing from the aggressor. And, it's funny because I almost slipped and said perpetrator. And just going back to language, that was the
Yeah.
distinction that was
Yeah.
often made as called perpetrator and victim. And that's
Yeah.
really lacking empathy for
Yeah.
that person, right?
Yeah.
But
Yeah.
often, I mean, I would assume that the person who's doing the aggressing lacks self-esteem because they're hurt and they're angry. And this is coming from a place of
Yeah.
pain, this behavior.
And
So,
isolated. There's this kind of deep sense of isolation, and I think by kind of also having a parent who would, and as I've said, this is an absolutely normal need to protect someone who is being like abused, right? This is just what absolutely needs to be done, as you've said.
right.
But I can imagine how conflicting this position is for a parent, where they would have to hold space for those two different children who have completely different demands, pain, and would need have this different kind of skills, or hold those different feelings. And it's such an incredibly challenging place for a parent to be in.
Yeah, you hit it right on the mark, which is why I think I've been able to forgive my parents, right? Because I've lived through this experience, and there's a lot of resentment and a lot of pain that came out of that. And parents are flawed. They're people with limitations who are doing the best they can. Sometimes the best they can may not be good enough, but they're really doing the best that they are capable of doing. And there's no guidebook and there's no tools to say, if your children are behaving like this, this is what you should do, right?
Yeah.
And which is what you're striving to do in this recording, in a sense, right?
Yeah.
And I think that the true answers are going to come, and it's on my to-do list to conduct a study of the aggressors to really understand what did they need, what were they experiencing at the time, and what can we learn from that in terms of arming parents with the ability to detect this, prevent this, and then intervene if it does occur?
Yeah. And I think it would be amazing to, once you do this study, perhaps we can have another conversation about it, because it does sound so incredibly important as a way to both prevent, this, what can happen in the family, but also give parents tools to also understand, without that kind of shame, but also just to give us as parents tools as to what do we need to notice, what do we need to be aware of, or perhaps what do we need to work on as well in our own therapy, or whatever kind of journey of healing and growth you are kind of taking as a parent. But it can be something that you use to heal that part of yourself that maybe contributes to the parenting style that could not directly but indirectly create some of that dynamics, because a family is a unit, right? And everything that happens in the family we kind of create together. So I think it would be amazing to hear more on that. It sounds incredibly important. And I really just want to thank you for this conversation. It sounds like it's incredibly important work that you are doing. And as I said, there's you started with talking about it. There's lack of awareness around it. And I hope that we're going to hear more about your work. And just as a society generally, we're going to be talking more about things that can impact any family, whether, no matter how hard we try to control, we don't have that control over everything that happens. So that's why talking about this is so important.
Well, I just want to say thanks for the opportunity. I mean, any opportunity to spread awareness about this, relationship within a family is a welcomed opportunity. So thank you. And I just want to say, if I could, that I also have a podcast called What Would Dr. Meyers Do? And on that podcast, there is a series on sibling abuse. So if you want to learn more about that experience, the lived experience, and what it looks like, what the risk factors are, what the protective factors are, what the enduring consequences are in terms of intimate relatedness and relationships with others, and hear some stories from people who have had those experiences. Tune in. What Would Dr. Meyers Do? It's available on multiple platforms. And thank you so much, Marina.
It sounds amazing. And I just want to quickly say, we're going to link your podcast. We're going to link your contact information, perhaps for people who would like to get in touch. And for everyone who's going to listen, just if whatever we're talking about resonates with you, if you do have experience with what Amy was talking about, please put it in the comments, what came up for you as you were listening. But also, if you are a parent and you're concerned about some of the things, or you just want to reflect on some of the things as you parent siblings, also put it in the comments and subscribe to the channel, and let's talk about mental health and parenting, all the emotional demands of parenting without shame and stigma. Thank you so much, Emmy.
Thank you.